This is Preeti and you are watching Med Resolution. In this video, you will be learning serratus anterior muscle, which has been asked as a 5-mark question, but that is a short essay in the revised syllabus 2, that is RS2. They have asked attachment, nerve supply and action. Attachment, you have to write both origin and insertion. First I'll be saying a little introduction about this muscle, and then I'll be discussing about all the other sub questions. And winging of scapula is a case study question. This is an important case study question. Introduction. This cloths the wall of the thorax. If we consider this as thoracic cage, that is rib cage or thoracic cage, it will be present like this. It covers the thorax. This is a serratus anterior. This hand is a serratus anterior muscle. It covers the thoracic cage. As you can see here, this is a rib and it covers the rib cage. So this covers the rib cage, and this is not the muscle of pectoral region. Still we discuss this muscle here for our convenience. This originates as 8 digitation from the ribs. As you can see, this originates as 8 digitation: 1, 2, 3, 4, 5, 6, 7 and 8. First digitation will be in between first rib and second rib, and second digitation will be in between second and third rib, whereas third digitation will be in between third and fourth rib, so on. It has 8 digitations. Origin, it originates by 8 digitations from upper 8 ribs. As you can see, first rib, second rib, third, fourth, fifth, sixth, seventh and 8th, upper 8 ribs. It originates by 8 digitations, and then it is inserted into the, so this is the superior angle of scapula, this is inferior angle of scapula, this is medial border of the first scapula. Scapula has 2 surfaces. This is a costal surface which will be close to the rib cage. This is a costal surface, whereas this is a dorsal surface. The coastal surface, dorsal surface, our anterior surface. This we can say this is inserted into the medial border, anterior surface, superior angle, inferior angle and medial border of the costal surface. On the superior angle, the upper 2 digitations will insert on the superior angle. Next 2 digitation will insert on the medial border. Remaining out of this, remaining 4 to 5 digitation will be inserted onto the inferior angle. This will be the original insertion of serratus anterior muscle. And then nerve supply. Nerve supply, it is supplied by the first 2 digitation will be inserted into the superior angle, next 2 digitation will be inserted onto the medial border, next 4 to 5 digitations will be inserted on the inferior angle. Nerve supply, this is supplied by long thoracic nerve which has a root value C5, C6 and C7. And actions of these are powerful protractor of scapula. As I already said, this is the rib cage. This is a scapula. Protraction means it pulls the scapula close to the rib cage, and then it pulls the scapula forwards. As I said, protraction means it pulls the scapula forwards, and it helps in punching and then pulling movement, pushing and then punching movement, forward movement. So this serratus anterior muscle is also known as boxer's muscle. Boxers do like this, no? So it is also known as boxer's muscle. It keeps the medial border of the vertebrae. As you can see, this medial or vertebral border of scapula. This is a medial border, this is a lateral border, this is medial border, or here vertebra will be there, vertebral column will be there back side, and this is a medial border. So this is also, medial border is also known as vertebral border, that keeps the vertebral border close to the rib cage. In case of winging of scapula, as we have studied, in case of winging of scapula, we have to study this because the important case studies many times they have been asked, and they'll ask you this question in Viva. Winging of scapula, injury to long thoracic nerve. Long thoracic nerve was supplying to serratus anterior muscle, but injury to this muscle, it paralyzes the serratus anterior muscle. So serratus anterior muscle was a powerful protractor. It brings the scapula close to the chest wall. But now in this case, as the serratus anterior muscle got paralyzed, the protraction become weakened. So this medial border and then inferior angle, as you can see here, medial border and inferior angle of scapula become prominent when you push the something hardly, which is this thing will be in rest. This cannot move. If you push that thing, if you consider as a wall, if you push the wall, this medial border and then inferior angle of the scapula become prominent. This is called winging of scapula. Thank you. If you like my video, please share my video and like my video.